I'd like to, my name is Janet Rosenzweig. I'm the Executive Director of APSAC, and it's my pleasure to welcome you to this, our first Zoom chat. I want to make sure that folks know we intend for these conversations to be interactional, so we will not mute you on our end. So we respectfully request, if you're working in an environment where there are distractions, if you would be kind enough to mute yourself. We would very much appreciate that. That way you can unmute when you want to come in and ask a question, because we really hope this hour together is interactional. So again, on behalf of APSAC, the American Professional Society on the Abuse of Children, we welcome you to this chat. I'm kind of multitasking and I keep admitting people from the waiting room, so if I seem to be looking in two directions, I am. Today we've got 3 representatives from APSAC joining us. Myself as the Executive Director, Jamor Maddox, Dr. Maddox, a psychologist, is a member of our board of directors. He'll be taking over as facilitator and sharing this with me. And Bree Stormer, a name you've probably seen on almost every email that comes out, our manager of publications and special projects, who will be handling our technical stuff and our research. And whenever something comes up that maybe needs to be emailed to the whole mailing list, Bree will be able to take care of that for us. So we're very, very excited about that. I thought I might spend a minute or two telling folks what APSAC is doing to support our members, to support our profession in response to the COVID-19 crisis. We've got first of all, our chats like this. We hope we find out today that people consider this a good use of their time and want to join us again. Give us some advice about how to make sure that it's as useful as possible. Okay. All right. I'm also going to remind folks that so that we are not muting the audience, so to please mute yourself if that's okay, until you've got a question to ask. We also have created on our website a special resource page where we're curating the resources that have come from organizations all over the country, resources for parents, resources for professionals. As it comes hot off the presses, it'll go right to that page, and we encourage you to stay with that. Our publications committee met this morning and decided we're going to be doing a series of APSAC alerts, just our short one-page briefings on hot issues, where we'll be looking for experts to be writing on things like avoiding sexual exploitation online as kids' screen time goes up during this time, advice for families to deal with stress, to advice for child protective service agencies, and of course an issue that's got everybody concerned now is delivering services virtually. To telehealth. So we'll be looking at those issues coming up in the near future. Those of you that are close to APSAC know that one of our most important events each year is our colloquia. We'll be making a decision, it's scheduled for June. We'll be making a decision by the board in April, but the fact that we haven't made a decision to cancel or go on doesn't mean we're ignoring it, rather we're waiting for the most timely information. We're also staying very close to our colleagues in Washington, monitoring what's going on at the federal level and the policy level. We've got very, very strong advocates working through the National Child Abuse Coalition, Child Welfare League of America, making sure that any COVID emergency aid package also addresses the needs of the child welfare community. Obviously, that doesn't come top of mind to a lot of people, but rest assured that there are very strong advocates in Washington working to make sure that happens. There are several different packages working their way through the legislature now, and the advocates have got lots of input into making sure that child welfare is mentioned. They've also made it clear through guidance that came out yesterday from the Administration for Children and Families that questions about how Child Protective Services visits are conducted, whether it's okay to conduct them using video, a straight up Child Protective Service visit is dictated by state level policies. The feds, however, do have the authority to dictate the parameters for foster care visits, and the feds have allowed televisitation for foster care. So that's news that just came out yesterday I thought I would share. So that's a couple of things we're doing, putting out information, monitoring things at the federal level, making sure we can get information to you as quickly as we can. And on that note, I thought I'll turn it over to Jamora Maddox, and we can talk about some of the questions that we thought might be more germane. And let's see if we can get that slide to, okay, can folks see the slide with the questions, or are we having technical issues? There we go.
It was just up. There it goes. Thanks, Janet. Thanks for that great introduction and for some important information right up top. I'm Jamor. I'm the treasurer of APSAC. I'm also on the board, and it's my pleasure to be with you today. It's somewhat selfish. This is my opportunity to socially connect during a socially isolated time in my life, and I'm sure everyone here could relate. Everything is kind of upside down, so it's nice to connect with colleagues in the child maltreatment community to discuss these pressing issues. So I'm a private practitioner. I'm a psychologist. I provide services for CPS in the state of New Jersey, mostly around evaluations that are used for fact findings, but I also have a number of treatment cases. I carry a caseload of about 20 or 30 or so. And luckily, I've been able to use telehealth to remain in contact with many of those families. But in doing so, the learning curve has been somewhat steep because I wasn't a telehealth provider to any significant degree before this. So I picked up some information along the way. I'm sure many of you can relate. You've had to do the same. I figured I would start just by sharing some of the things I've learned, because it's the very introductory, basic stuff that many of you probably have learned. So let's just get all of that out the way before we get into your more complex and specific questions. The first thing I want to speak about is this concept of acceptance and how we can quell fear, not just for ourselves, but the people that we're serving. Acceptance of the fact that we are indeed in an unprecedented situation. We've been through unprecedented things before in the child maltreatment community. And it's really an opportunity, in my view, to forge new ground and to approach with an optimistic spirit. I think that's somewhat of a mandate that we have to model that for the people that we serve. Obviously, if we look like we're out of control and totally anxious and bent out of shape for those we're serving, it'll be hard to play a very therapeutic function in their lives. Even in working with the kids that we serve, they detect that stress and that anxiety. So we have to make sure we're doing good self-care, come to a place of acceptance with this pandemic for ourselves before we step into the room with those that we treat. And then when we do so, some practical tips we may want to share could include avoiding social media and not becoming overly involved in it at this point. Maybe kind of regulating the types of media sources that you rely upon for your information, because too much media of any kind can impair your mental health. Making sure you're really getting your information from trustworthy sources, and just taking those important media timeouts. That could go a long way. Now, for those that are adopting telehealth practices, just some rules of the road that I picked up right along the way. FaceTime apparently is not a HIPAA compliant platform, as they are unwilling to offer a business associate agreement. If others have heard differently, then in a minute here, I hope you'll jump in and share. One telepsych or telehealth platform that I've been having success with, especially since it's free, is called Doxy. This isn't an official endorsement by APSAC by any means. It's just my own personal experience. And it's free, doxy.me. It's a free resource to sign up for. But then when you do telehealth, it's important to make sure you have the person's consent. In other words, they need to understand that in using this platform, there could be various hiccups, various threats to privacy. All of these details you can find more about at APA.org, I believe. Their telepsych guidelines. It's a nice document. It really gets into the rules of the road concerning telepsych in as much depth as you probably need. The guideline, so it's written aspirationally, meaning it's going to overshoot what you need to do and actually get into what you should strive to do as a professional using telehealth. Maybe Bree can visit APA and find those telehealth telesite guidelines and put it up in chat here. If you have a lot of stuff going on in the background, if you could just mute the Zoom so others can hear the information better, that would be great. With the goal of keeping this short, I just want to get into risk, legal, and ethics really fast. So some of the legal issues that have come up as I've made this transition surround my malpractice carrier as a psychologist and what they're willing to cover. I was surprised to learn that if I decided to meet with people face to face and God forbid someone should get sick or credibly believe that they're sick from time spent in my waiting room, then that may be an issue that could come before the board, my practice board, my licensing board, and it could also become an issue that my malpractice insurance company may not like. In other words, they weren't able to guarantee me that they would have my back in such a situation if I engaged in such a professional practice. I'm happy I gave them the call, and they really introduced this interesting discussion around ethics and doing no harm. And while we're receiving important information from the CDC about social distancing and how far that can go to prevent the spread of the virus, and how and to what degree we should be acting in order to be sufficiently responsible, it almost seems as if some of the malpractice carriers will expect you to go even beyond that if there is another option for you to use. If there isn't, then the conversation would be different. But given telehealth is an option, my malpractice insurer would like me to pursue that road instead. Other issues around ethics, maybe we can get into more in the conversation as it comes up, but I wanted to throw that one out there right at the top. So these are just some of the things I've stumbled upon. I just wanted to kind of get the conversation going about what I've learned, but this is interactional, it's not a webinar, so I'm hoping to personally benefit from what the group has to share as we wrestle with some of the questions that we've all thrown into the mix here that we're going to go through now. Janet, questions from participants? Is this a good time to shift to that now?
Absolutely. Would anyone like to jump in and respond to anything either Dr. Maddox or I have said, or should we go through some of the other questions that you sent us? We really would love to hear your voices and not just ours.
Dr. Maddox, can I ask a quick question?
Sure.
Can I ask if you identify yourself?
Sure. So I'm Jennifer Bettina. I'm with the CAC Hope House in Covington, Louisiana. Let me make sure I understood what you said. What I thought you said was that your liability insurance was the one that said that you could be liable if somebody got sick in your waiting room if you were doing in-person therapy. Is that what I understood? Did I understand that correctly?
Yeah, precisely. I asked the question very candidly to them. If someone was in my waiting room and they believed they got sick, or indeed they did get sick, would you guys have my back? I put it in very common language for them. And I was told, maybe, maybe not. If there are other options, we would highly encourage you to use those instead. That's all I needed to hear for me to make the shift. Does that answer your question?
Yes, thank you very much.
Just so you know, this is the Trust Malpractice Insurance Company. I'm not sure if you're a mental health practitioner, but I'm different.
I am, and I use HPSO, so I'm going to probably call them myself. Thank you.
No problem. There are also, if you're working from home like me now, in the home office using telehealth, some malpractice insurance companies may have issue with claims brought against you when practicing from home using telehealth as opposed to practicing from your office. It sounds somewhat ridiculous. I was surprised by this, but it's worth making a call to see if I'm practicing from home as opposed to the office address you have on file as my carrier. Would you handle a claim differently when I'm using telehealth?
Dr. Maddox? This is Deborah Sims. I am a child abuse pediatrician up here in Grand Rapids, Michigan. And I understand you asked a very basic question. My problem is that no one is totally isolating themselves. How would they be able to determine proximate cause of their illness, especially given the extended incubation period of this illness, that it wasn't at the grocery store, at the pharmacy, or by a family member? I mean, I guess I'm disappointed in your insurance, and I'm definitely going to call mine. I don't know how anyone can point up, because at some point in time, we're going to have to resume normal interactions and normal things. And I guess I don't truly understand that if somebody catches influenza B, which can be just as serious for certain populations as this disease, people die from that. We have a what, 2%, 2.5% death rate from that every year despite vaccine. I guess I don't understand why the insurance companies would not support us. It's a germy world out there.
Deborah, you raised a great question, and you used the term proximate cause, which is a legal term essentially requiring the claimant, the plaintiff, to establish that if not for my action in letting someone use my waiting room in the midst of a pandemic, that person would not be ill. The plaintiff would have a responsibility to prove that in bringing a successful claim. I think this is where the insurance is coming from. I think that while the claimant or plaintiff, formerly known as my client, may have an uphill battle in some type of personal injury claim, I'm not sure if my insurance company was convinced that they would have a hard road proving that I was unethical in my behavior, in that I maybe perhaps did not do as much to protect them from harm. And so maybe the concern was more of like a board complaint response on their behalf, and less of a issue concerning a tort case or a personal injury case that may arise from the decision.
Hi, I have another, if it's okay.
Sure, please.
Okay, great. Just along those lines, but not from a private practice perspective, but of course it's all connected. And I'm not going to identify myself per se, because I feel like I work in foster care, and I feel like, I mean, I know the rules are changing from day to day and all of that, but and I know, I'm so glad to hear what you just said, which is the federal government has now allowed case planners to do their visits by telephone, correct?
For federally required foster care visits, yes. I can have that directive. I'm going to send it to Bree and have her shoot it out to everybody on this call. So if you registered for this call at your own email, you'll get a copy of that directive.
That's great. Yeah, no, I think it's just that, I am still being mandated. I'm not a case planner, but I'm in the mental health area. I'm still being mandated to come into the office, even though I'm an older person as well. And I'm again, there's a lot of people who are at risk, and maybe that's no longer even a standout issue. But I feel like if a lot of these services can be conducted via telehealth, which is what I've been doing on the alternate days or the staggered days that they're now setting up a schedule for folks to come in. I don't know how to advocate for myself. I have made a point about it, and I would never, and I am not in a position, nor do I think it is wise for us to have clients to come in, ask them to come in, get on the train with the children for mental health assessment in person. And again, I don't think the agency is encouraging that. But if I'm not, in a way, what I'm raising is for everyone's health, because I don't know how much I've been exposed, like other people have been exposed. How do we advocate for ourselves to make sure that we are still able to do our jobs, but that we're healthy and trying to protect ourselves?
It's a great question. I hope others will jump in. I have a quick response, but it's not the best one. I received an email yesterday. Again, I'm in New Jersey. I received an email yesterday from the commissioner of CPS here, indicating that the decision for CPS workers to work remotely was made in collaboration with their union, their employee union. So I'm not sure if you have a union rep, but if you do, perhaps they could be helpful to some extent.
Yeah, no union rep. That's, I'll tell you right now. Yeah. But I will say that I have heard at a university level that the way in which those staff are able to work remotely is that the union fought for them. So in this case, an acknowledgement to the unions for making things like that happen. Thank you.
Other questions or comments for Dr. Maddox? Okay. Maybe now we can turn, if you see on the slide, this is the major categories of questions that you all submitted to us as of about 2 hours before we called the meeting to order. So why don't we can hit them one by one, and I'll tell you what I know about the issues and then open it up for everybody else to chime in. There were several folks wondering what people knew were going on about handling Child Abuse Prevention Month activities in April. We were on another call this morning with representatives from multiple states who basically are saying, look, my state government is shut down, so there's nothing going on. They have more important things to worry about, which some of us could see as an opportunity to come in as a nonprofit or come in as another kind of service organization. The one thing I'll also say before I open this up is April is also Sexual Assault Awareness Month. So the whole National Rape Crisis, National NSVRC, the National Sexuality, NSVRC.org. They handle the national sexual victimization, but they'll have their whole national campaign going on, which generally is much more online than what we see coming out of folks with CAPTA. So that would be another one place to look for collaborators. But does anybody want to chime in with some things that you might be doing about Child Abuse Prevention Month, even though your state government might not be in the game right now? Nobody's got anything they're thinking about for Child Abuse Prevention Month?
Sorry, hi, my name is Mary Cloud from Glenwood Springs, Colorado, Riverbridge Regional Center. And for child abuse, we're still gonna do our pinwheels on our courthouse lawn. We're still gonna do that. And I'm gonna try and do a Facebook live feed, so that way try and have a little bit of a virtual rally, even though there will be very few of us that are gonna be putting the pinwheels in the garden or in the on the lawn. But I then will hope to try and do a series of some virtual events, maybe having one of our therapists talk about mental health therapy that we provide, talk about the statistics around child abuse and neglect that we've had in the past year. So just trying to have more virtual events to try and raise our awareness.
That's great. Some other ideas that we've heard along the way, in a lot of communities, you still have restaurants that are open for takeout and delivery. So if there's flyer or literature that you might want to distribute, partner with restaurants that are still doing takeout and delivery, and maybe to put pinwheels or whatever other information you've got available in bags. This might be a great time that parents that are picking up a pizza would appreciate some kind of parenting support information. We've also, and this is, it still might be an appropriate time to ask your local county or city government to declare it Child Abuse Prevention Month in your community, recognizing the stress that parents are under right now. If folks would like a sample proclamation that highlights that, just say so in the chat box and we'll make sure we send a sample proclamation out to people at the end of this. can folks have your also your local media might be looking for some good news right now, you know, something to get people's attention on your local morning talk shows other than straight talking about the virus, and maybe be able to call into radio talk shows and make plans now to partner with some local media on this. So there could be ways, there could be ways to still get our message about supporting parents to give kids great childhoods out, even though people aren't going to be congregating around actual pinwheel gardens. So anybody else want to chime in with something that they've heard going on in their community?
This isn't something in my community, but I just wanted to put out, I don't know if everybody's seen that the Darkness to Light Stewards of Children trainings are available for free right now to anybody who wants them. So you can go to those websites. There's a couple of different things that they sent out in case you didn't get the emails. And I was thinking about doing a social media campaign to make sure that families in our area know that they can go online and see those trainings at this time.
Wow, so the Stewards of Children's training is free during this time?
I do believe they have the online training for free. I know, I'll send you the email. Am I going to get your contact information at the end?
You can send it to info@apsac.org,
Okay.
and then we can
Sure.
get it out to everybody on this call.
Okay.
So
I'll forward it to you.
info@apsac.org, and we can get it right out. This is the kind of thing we were hoping would happen with this call. Somebody would have a great resource, we could talk about it and then put it in everybody else's hands. So thank you so much for sharing that. That's an excellent resource. If that's free now, that's wonderful.
If I can just contribute, the online training is available for free through Darkness to Light through their Flip the Switch initiative. So if you go on their webpage and you find Flip the Switch, that's where you're going to be able to access that training online for free.
Sure. Well, if you want to put that in writing for us, we'll get that out to an email to everybody on this call. And if you want it to go on the APSAC resource page, please let us know that as well, if that's okay. Any other thoughts about Child Abuse Prevention Month? Has anybody's agency come up with like a virtual like Wear Blue or something like that? Or you're doing any kind of virtual Child Abuse Prevention Month activity?
Janet, this is Deb Sims again. I'm up in Grand Rapids, Michigan. I am a physician. We were planning to recognize those individuals in our children's hospital that take care of our victims.
Your voice is coming in and out, so we're not hearing everything you say.
We were wanting to support the medical people taking care of the children in the hospital. Obviously, with everything that's going on with COVID and everything now, we're going to have to put that back at least a month. But I think that doing something in recognition for our medical staff, that these are very stressful cases for them. And I would encourage that in addition to public awareness and in addition to family support, that people really do understand the medical people that are taking care of these children.
That's
right.
a wonderful point, that those of us doing messaging during April could keep that in mind. Thank you for sharing that. So, let me move on. Let me move on to our the next topic that people asked to talk about, and that was home visiting safety. Bree, if I could ask you at this point, if you could share the CDC guidance on law enforcement safety that we have up on our website. That's probably the only thing that I've seen that has come out of CDC that could be applicable to Child Protective Services workers or other home visitors making home visits. They have very clear directives about wearing gloves, wearing face masks, keeping the social distance, and most importantly, if you think someone is ill, not to transport them in your own car, but to have emergency medical technicians come and transport. So you're doing a home visit and see a child with symptoms, a CPS worker, a Healthy Families America home visitor should not be putting that patient in their car and driving them to the hospital. Clearly, they should be calling for local EMTs. So we'll share the CDC's guidance, but if there's something else that somebody else would like to add, I'd very much like to bring that on the table.
Janet, what they're doing here in New Jersey is equipping what they're calling an impact team to go out into the homes for very high risk, high priority cases. They get called in, and that team will be trained in a variety of different ways to keep themselves as safe as possible. The word hazmat training was used when I contacted CPS. I know also in New York, if you, maybe you can send this out for those curious. The link I'm uncertain about, but if you Google CPS home visit COVID, you'll see a memo that came out of the governor's office in New York, kind of describing how they've decided to go about it. It involves a screening process between the highest risk cases and those that perhaps aren't as high and could be handled through Skype. But for those that are really high risk, they're going to ask questions such as, if you've come into contact with someone recently who's been exposed, do you have symptoms, etc. And depending on how you respond to those questions, they'll then go out to engage the youth, interview the parents, but will strive for that contact to take place actually outside of the home. Just two examples of how states in my region are proceeding with home visiting safety.
Can anyone else chime in on what their state has been advising or doing about home visiting safety for CPS? Okay. From the control panel that I see in the background, it looks like a lot of folks have dialed in and aren't on their screen, so you can't see the chat box. I just want to share a couple of things that have come in from the chat box. Melissa Zimmerman pointed out that they're doing a coloring page contest. I think, Melissa, you're with, Melissa, can you identify yourself and tell us what agency you're with?
I'm with the Crime Victim Center in Chester County, Pennsylvania. So we're a pretty much like a rape crisis center in our community. So we kind of join together with doing Child Abuse Awareness Month with our Sexual Assault Awareness Month. So we are doing a lot of, you know, using technology, using social media, and really kind of relying on that. So we have a social media campaign that we'll be running through the month. We're doing like self-care Sundays. So on Sundays, our staff are sharing ways that they're taking care of themselves. We have a self-care soundtrack that we're putting together. So like a Spotify playlist that people can listen to, that motivate us, that keep us going. We're also going to be doing that coloring page contest. So the NSVRC has coloring pages on their webpage, and we're going to put those up so people can print them out, color them, and then post a picture, tag us in it, do like hashtag Sexual Assault Awareness Month, and then we're going to vote on a winner of those posts.
So Melissa, there's also on the chat box a request for you to put the entire URL in the chat box, people saying, I can't locate it from the homepage. So if you wouldn't mind cutting and pasting the URL to get to your coloring pages contest, we've got a request for that.
Perfect. Yeah, I can actually, I'll send you that link right now. I do have it open on my page.
Okay, so you can send it to info@APSAC and we can email it to everybody, or you can, and I see you cut and pasted it into the chat box, which won't help the people who can't see the chat box, but we can pick it up and drop it in an email. Bree can drop it in an email and make sure that everybody who's registered goes ahead and gets that. So that's great.
So we've got, I'll take all these links that I've posted and others have posted and send them all out in an email following the call for sure.
Great. We also see a message from Elba Kareem in Illinois that basically says all the home visits are generally suspended, and some people are, you know, Illinois is allowing workers to check on children in care virtually. So there's an example of how one state is responding. They are allowing certain checks to be done virtually. The next question that people put up, and I, open this for discussion because there's certainly no easy answers, is what's being done in your community to support families who really rely on the safety net to help prevent child neglect. We're all here about workers in the gig economy, for example, the lower income workers who maybe weren't known to CPS, but as their resources disappear, are going to find themselves in financial need. Does anyone's agency or community want to share an example of someone being proactive to talk how we're going to prevent neglect as parents are facing really difficult economic times? Not hearing any initiatives, would anybody like to suggest what they wish they would see happen? And we can make sure that those suggestions get incorporated, for example, when I'm on those conference calls with the lobbyists talking about how to use social service block grants or community service block grants. Because this one, probably as much as the disease itself, frightens me quite a bit about families hitting economic hardship and what that means for their ability to parent. Anybody else want to chime in on that? It would be very much appreciated.
Janet, can you hear me?
Yep.
Yes, who is that?
My name's Mickey Lane. I'm with the Child Advocacy Center in Springfield, Missouri.
Great.
And we serve a rather large service area of 15 counties, including Springfield, which is the third largest city in Missouri, but then also a lot of rural. And many of our public schools are providing food, meals for for people in their district that live in their district throughout our service areas. So we are in the process of trying to gather the information so that is something that our advocates can follow up with families that they're doing their follow-up calls with after their CAC appointments, as well as those families we're currently serving, to try to reduce that stress, and also making sure that we're staying in contact with our various food pantries throughout our service area and other organizations and churches, just trying to gather all of that information so that we can be directly providing that, at least to the families that are within our service.
Thank you. Thank you very much.
Yeah, that's an important one around food. In fact, that's the only thing that I've heard in regards to proactive efforts for those relying on the safety net. There was a bill introduced, I believe, just a couple of days back, maybe the 11th or so, by 2 representatives in order for schools, for kids to get free and reduced price lunch, to have those meals delivered to them. Anyone else hearing of stuff like this in their local communities?
Hi, this is Amanda Altman. I'm from the Christie House CAC in Miami, Florida, and our schools in Miami-Dade County are providing breakfast and lunch for children at no cost. They have specific times that the kids can go pick up the meals, and our case managers and family advocates at Christie House are calling all of our clients to make sure that they know about that, so that they know the times that they can go pick them up. In addition, we have an emergency food pantry and gift cards that we are providing to families for groceries and grocery shopping.
In Chicago, I know that there are some organizations, or some restaurants rather, that are using their extra food to pack up free meal boxes for folks who work in the service industry and in the gig economy and their families. And their staff are packing up boxes and passing them out, no questions asked to families until they run out.
It's great. We see a couple of things in the chat box, and again, it looks like more than half of you are just here on the phone and not online. So I'm going to read the latest comment. This came from Elba Kareem. I'd like to see the e-learning platforms include information about supports to parents, about abuse, neglect, self-care, and co-regulation to all of their users, especially as schools go virtual. Some teachers and staff are checking in virtually with each student at high risk in the form of a fun activity to keep connection and provide a bit more safety. Anyone want to respond to that idea about partnering with the schools who are keeping in touch with, who are providing the e-learning platforms, and hopefully that way keeping in touch with kids and families. Because I know one of the fears as schools become virtual is that the overwhelming majority of reports to CPS that are substantiated do originate with teachers. And as we are at a point where teachers aren't having direct contact with kids, what is that doing for the potential of not catching risk? That's an important question. Anyone have any thoughts about that or developing any kind of partnerships around that?
This is Susan in California and Arizona, and I'm looking at the Facebook page and seeing the announcements from APSAC and the Foundling and the U.S. Alliance and the Hitting of Children and the Zero Abuse Project announcing the social media contests. I can't think of a better time for us to really spread the word to teachers and school administrators about this. It's the Hit No More social media competition. This could be another way to keep this, the idea of persuading us that physical punishment is never okay to use and quit hitting children. To get that, keep that discussion alive on alternatives and creativity to end corporal punishment and promote positive, peaceful parenting around the country during Child Abuse Awareness Month.
Hi, it's Leslie from the New York Foundling. I'm actually working on that campaign, so I can send APSAC some information about that too, and some more ways for people to get involved in that.
That actually could be a great activity for like high school kids that are home to actually prepare, you know, to actually produce some social media content and enter it into the contests. And so that was, yeah, that's a great idea. Thank you for bringing that up.
And there's monetary prizes for people who win the contest too, which can be very helpful right now.
No, a part of what the Alliance and along with Zero Abuse was doing was reaching out to faith-based communities and trying to get them to understand all of the issues around corporal punishment. You know, faith-based communities are still maintaining their audience with their parishioners. In fact, some reports suggest that these audiences are growing as these faith-based communities are exiting their four walls and are going digital. So maybe reaching out to those communities along with Child Abuse Prevention Month and along with the no-hit zone materials could be very timely now, because there's somewhat of a toxic brew of parents with inappropriate expectations concerning how their kids should be doing at school. Now these parents are in the role of actually seeing how their kids are doing at school as they're educating them while they're home. Plus the parents are stressed, they're facing economic uncertainties and all types of issues around how are they going to get their groceries. Parenting stress is high and risk is certainly increased. I mean, I know I'm preaching to the choir, so it just makes all of this really timely and relevant.
Bree, can you send out the link for ordering or previewing the no-hit zone materials? This might be a great time to get them in the hands of, you know, something you might do for Child Abuse Prevention Month is get these in the hands of the faith-based organizations in your community, because Dr. Maddox is right that people are still staying in touch. I'm watching the clock, and there were two more topics I want to get to before we hit the top of the hour. One category of questions that came in was, how do we support caregivers who themselves have experienced trauma? I know there's clinicians among us on the phone. I'd like to turn this question over to folks that have clinical training or specifically in trauma-informed practice. So would anybody like to start that conversation? Well, Dr. Maddox, as a psychologist among us, may I ask you?
It just somewhat paradoxically, during one of my sessions last night, someone I'm working with in the areas of trauma and panic indicated she has never felt more normal because now everyone around her is traumatized and panicking. And so it's like everything's turned upside down. Now they find themselves in actually a place of feeling quite comfortable. That said, we continue our work as we've been doing around exposure therapies and different coping practices, around the idea of acceptance, building capacity to hold the distress that they're experiencing now, to tolerate the burn of the void of socialization, given the changes due to COVID. So these are, that's just the way I work. I work around behavior therapies, acceptance and commitment therapies. So those are that's some of the language that I use with the folks I work with. But I think the most interesting take home is how I started, with how the anxiety now feels to be more of a widespread normal thing.
Is it okay if I contribute?
Yes, please.
Yeah, please. Yeah.
So I'm a master's student at Montclair State University in the Child Advocacy and Policy program. I communicate a lot with survivors and parents of survivors through online social media platforms. And one of the key things to people who are traumatized is an overwhelming sense of powerlessness. And so there's nothing like a pandemic to make you feel powerless. And so one of the ways that that we just sort of keep trying to inspire hope is to communicate or share what choices you do have. When we look at a pandemic of these proportions, it's a very real threat. And even though people are facing very practical threats, just the fear of an unknown and an invisible force and lots of constraints. For many abused and traumatized people, isolation means additional abuse, or at least historically meant additional abuse. And not being able to make your own choices can feel very, very isolating. So to be able to reach out and encourage people to make a list of what can I do, what options do I have, can feel very empowering, as opposed to focusing on just what I can't do. And also sharing information about actual facts. So wherever misinformation can propagate, terror can reign. So communicating the actual science-based evidence people can be very helpful to help people to be calm and empowered.
So, excellent contribution. I see Elba has posted some stuff here as well. For those that can't see it, she indicates offering free consults and services to other providers, teachers, first responders, etc., and doing check-ins with those that she serves around co-regulation, self-regulation activities, etc. So those are some great comments to kind of combine different initiatives led by government and the conversation we're having now. There's been a loosening of telehealth, telepsych restrictions for those that are Medicare, and I also believe Medicaid recipients. So some of the issues that prevented delivering services online to different groups have now been loosened. Even with the private insurers, I've been receiving emails from Cigna, Aetna, etc., suggesting I can offer telehealth services to individuals in different states. Here's how it'll work. It's implying that there's been some loosening of restriction in order to reach out to these folks.
Okay. Watching the clock, there is one person who wrote to us and said that identified themselves as a technical assistance provider who really wants to know the needs of people serving families with substance abuse disorder. If the person who sent that wants to identify themselves and take over the discussion, that would be great. If not, I just put that question out. So what kind of supports, if you're serving families with substance abuse disorders, what kind of supports do you need at this time? No response. Okay. All right. Well,
I'm not the person. I have kind of the same concern. You know, we have families that the parents are, have abused substances in the past, maybe even recently, and have been doing well with recovery through all the groups that they've been doing, but can't do those now. And I don't know if our area, I'm going to have to look into it to see if our area is trying to find ways to have those groups virtually. I hope they are, but I don't know for sure. If anybody needs resources of that, I would love to know.
Yeah.
I wonder if the families or if these individuals could help us identify what they find supportive. Do they find an extra phone call or the telehealth kind of meetings helpful and useful? What kinds of things would they want so that they're not feeling isolated?
It would be great to hear from that community that we serve. And it's probably our responsibility to reach out and to gather that information. I see Debbie indicates here, seeing that some groups are being held virtually. Melissa chimes in with the same, indicating that she was provided a link from a colleague of an online AA meetings in PA. Celebrate Recovery, which I'm familiar with, they have an online meeting through Facebook. So Lisa, thanks for that one. That's a good one, both regionally and state. SAMHSA also recently sent out guidelines concerning those on methadone maintenance, indicating that they shouldn't have to go in to get their methadone, even if given the dose they traditionally had to. Instead, SAMHSA is suggesting, due to the pandemic, that they be sent home, that the medication be sent to the home for their own independent use. I wonder how drug testing works in this type of environment. And how does that interface with court compliance? You know, one of the issues is that here in New Jersey, family courts are closed except for emergent issues, high priority cases. So, yeah. Anyone else have any other thoughts about this issue around substance abuse and how we provide the services we need to in this type of environment? How about the dockets in the child protection dockets in your local jurisdictions? Are they have they grinded to a halt, or is the court still open as usual, the family courts?
This is Kim Childers, and I am in Oklahoma. I'm a forensic interviewer for our advocacy center, and the juvenile deprived dockets are still being heard, and protective order dockets are still being heard. But other than that, everything else has come to a halt.
Okay.
That's the same for New York as well, my understanding.
Thank you.
The one thing I just wanted to respond to in terms of just like you were doing here, generating ideas, is that in terms of support for people struggling with substance abuse, I'm wondering, you know, along the lines of AA, if there could be some sort of buddying up if they don't already have it, some checking in on phone kind of thing. I don't know, maybe SAMHSA has already set this up or other organizations, but if we can't be in groups to, you know, if for those who normally do go to AA groups, how, I imagine they have stuff. I'm curious, I'm going to look it up myself, what they're doing to support their members.
Jamor, you mentioned a directive you saw from SAMHSA. If that's correct, is that a document you might share that we could circulate?
Yes, I am. Bree, I'm just going to send this over to you now, and maybe you can get this up for the group. I just emailed it to you. It's coming from Chronicles of Social Change. It's a blog.
Got it. I will, I'll look out for that and send it along.
Yeah, there's a portion there that gets into that SAMHSA piece concerning methadone maintenance.
Okay. let's take the last remaining minutes and see if anybody has anything they'd like to put out to the group that was not on the list of questions that came in prior to the call. Open season to ask APSAC or any of your colleagues on this call.
Marisol Ibarra with the Parental Center in Tulsa. I guess what I have is more like a question. I don't know that there is really a contribution, but we have get a good amount of information of, to pass to our clients or program with parents as teachers provides home visiting. But most of them is in English. And so we serve a good amount of Latinos. And I don't feel that we have done really good job providing information to our clients, in their own language, or nor information to support their children either. So if somebody knows of a few
but it's terrifying, isn't it, to open the door?
So if somebody knows a few websites that, perhaps have focus on this, could you just post them and perhaps you can distribute them?
We certainly will look. I can tell you it's kind of specific, but the National Sexual Violence Resource Center, probably of all the national groups, does about the best job of doing everything in both English and Spanish. So if you're looking for sex abuse prevention, nsvrc.org is a good place to start. But I know that your question was a lot more general than sex abuse prevention. So we will put that out to this group, that if people are aware of resources for parents and families in languages other than English, please send them to us at info@apsac.org, and we'll get them up on our website on the resource page. So thank you for bringing that question. That's a really good one. Okay. So we have 2 minutes left on the clock. We want to keep to the hour because we know that many demands are pulling on everybody. For those of you who have access to your computers, if you could put in the chat box your thoughts about whether this is something you'd like APSAC to repeat, and if so, would you be interested in dialing in for an hour once a week during this time, maybe every other week? I'm delighted that so many people, almost everybody who pre-registered signed up. That's very unusual. Usually you get about half of the people that have signed up in advance. So thank you for showing the interest. But if you could let us know if this was helpful, should we do it again, how often, and know that we stand ready to support all of our members and everyone throughout the profession during this difficult time. And Dr. Maddox, if you'd like to have the final word, that would be great.
Janet, I agree totally with what you just said. We stand by, ready to help support. It's one of the reasons why I joined APSAC. As a solo practitioner, I was kind of on an island. APSAC became my homeroom. And now in the midst of COVID, that's never been more true. Some of the research coming out of this COVID epidemic and how we're responding suggests that the lack of control is what fuels stress, not only in us as practitioners, but also in those we serve. These meetings, particularly this meeting for me today, created a sense of control, if you will. We're all in it together. We're pulling together resources. We're sharing. It's something that normalizes the experience. I benefited from it. I hope you all have as well. Someone mentioned something about language and culture. Well, I couldn't find an exact resource during that break in time. I did find a webinar in using telepsychology, telehealth interventions in a culturally intelligent way. I sent it to Bree, and we'll make sure to get that out to you. APA's series on telehealth and telepsych is being made totally free for the time being. It used to be $150 per unit. Now all 4 units are free for APA members and non-members. We'll be sure to get that out to you as well. Thank you so much, everyone, for attending. And given what I see people typing in here, it looks like we'll be doing this again soon.
Okay.
Thank you.
Thank you, everybody. Stay safe.
Stay well. Take care.
Very well.
Thank you.
Bye now.
Thanks so much, everyone.